Hi everyone, my name is Chinmaye Thakur. I am a second year medical student and today we will perform cranial nerve examination. To test the sense of smell, make sure that each nasal passage is patent by compressing one side of the nose and asking the patient to sniff through the other. Then ask the patient to close both eyes, occlude one nostril and ask the patient to identify the odor. Test smell on the other side. To test the acuity of central vision, use a well-lit Snellen eye chart. Position the patient 20 feet from the chart and ask the patient to read the smallest line of print possible. Test the visual fields by confrontation. Confrontation testing of the visual fields is a valuable screening technique for detection of lesions in the anterior and posterior visual pathway. Test each eye separately. Inspect the size and shape of the pupils and compare one side with the other. Test the pupillary reactions to the light. Test the extraocular movements in the 6 cardinal directions of gaze and look for loss of conjugate movements in any of the 6 directions which causes diplopia. Check convergence of the eyes, identify any nystagmus, note the direction of gaze, look for ptosis, drooping of the upper eyelids. Palpate the temporal muscle, then palpate the masseter muscle. Note the strength of the muscle contraction. Test for facial sensory loss. Use a suitable sharp object. While testing, occasionally substitute the blunt end for the point as a contrasting stimulus. Ask the patient to report whether each stimulus is sharp or dull and to compare sides. Ask the patient to look up and away from you and approach from the opposite side. Lightly touch the cornea with a fine wisp of cotton. Inspect for blinking of the eyes. Inspect the face and note any asymmetry. Ask the patient to raise both eyebrows, frown, close both eyes tightly so that you cannot open them. Show both upper and lower teeth, smile, puff out both cheeks. Assess hearing with the whispered voice test. Ask the patient to repeat numbers whispered into one ear while blocking or rubbing your fingers next to the contralateral ear. If hearing loss is present, determine if the loss is conductive or sensorineural. Test for air and bone conduction using the Rene test and lateralization using the Weber test. Ask the patient to say "ah" as you watch the movements of the soft palate and the pharynx. Warn the patient that you are going to test the gag reflex. This reflex consists of elevation of tongue and soft palate and constrictions of the pharyngeal muscles. Standing behind the patient, look for atrophy or fasciculations. Ask the patient to shrug both the shoulders upward against your hands. Note the strength and contraction of the trapezi. Ask the patient to turn his or her head to each side against your hand. Observe the contraction of opposite sternocleidomastoid muscle and note the force of movement against your hand. Listen to the articulations of the patient's words. Inspect the patient's tongue as it lies on the floor of the mouth. look for any atrophy or fasciculations. With the patient's tongue protruded, look for asymmetry, atrophy, or deviation from the midline. Ask the patient to move the tongue from side to side and note the symmetry of the movement.